pleasure to introduce our flowers for today. Grethe from Norwegian. She's an associate professor of the also Sports Traumatology Research Center. She's also a long time, for 10 years, national team in handball for soccer, 6 years for volleyball, beach volleyball, and a long time she will to Seoul for Olympic Games and Sydney also. Please, Grethe, you have to take the floor for presentation.
Anyone having the pointer? Can you hear me loud and clear now? No? Yes? First of all, I would like to thank the organizing committee for inviting me to this. Philippe, thank you for letting me come to this conference. And today's topic is injury epidemiology in handball. And when I search for the literature, the number of studies is relatively sparse, and a lot of them are quite old. So I will mainly focus on the newest one. And the outline for this talk is I will talk about injury incidence, who gets injured, the injury location and type, talk about acute injuries versus overuse injuries, and use some time showing you different types of overuse and acute injuries. See the difference between the matched and training injuries, injury onset, and at last a little bit about the clinical outcome of injuries. This slide is unreadable, and it's not meant to read, but it actually shows the number of studies up to 2009. And we have studies looking at injury incidence back to early 80s. It's somewhat difficult to compare them because they have used different registrations methods. Some have seen all kinds of injuries, some have only looked at timeless injuries. So I will not go in detail about this table, but when I went through the studies, we have shown that if you look at the adolescents, the injury incidence is between, the studies have shown different numbers between 11 and 40 injuries per 1,000 playing hours. When you looked at grown-up or adult players, and this is both for male and females, the numbers are 13 and up to 36 injuries per 1,000 hours. And this is a lot of studies when I compare them together. When I looked at more recent studies, one study among the 3 upper divisions female handball players in Norway, we found that the incidence was 2.7 per 1,000 playing hours. An even more recent study from 2012, this was Danish, both female and male players. They found 6.3 injuries per 1,000 playing hours. And what we see in all of these studies is that the incidence is so much higher when you play matches than compared to training, and that's something we know that we are used to see handball. So it's 10 to 20 times higher injury rate in matches when I look to all these studies. So who gets injured? Well, the back players have the overall highest injury incidence in all studies. And in a study looking at ACL injuries in Norwegian female handball, and we have during the years seen and found 226 ACL injuries, and among those 226 injuries, 60% of the injured players were back players, 21 wing players, 8% line players, and 9% goalies. So the back players is the most dangerous place in handball. So what about injury location and type? When we look at both overuse and acute injuries, we have studies showing that 15 to 15% of the injuries occurs in the shoulder. Actually, a lot of head injuries have been reported. You see knee, 18 to 22%, and of course ankle injuries. Studies have shown between 9 and 45% of the injuries occurs in the ankle. And the ligament sprains and the muscle strains dominates. So what about acute versus overuse injuries? In this study, I picked out one study, a large study from Denmark, both girls and boys and men and women. And they captured 283 injuries during one season in Danish play. And the acute injuries, you can see that there were ankle injuries, had 29% of the injuries, knee, 19%, hand and finger injuries, 12%, shoulder, 7%, and lower back, 4%. And also thigh injuries with 8%. So this is the acute injuries in this study. When we look at ACL injuries, which are the most, well, frightened injury for handball players, we see a sex difference with 5 injuries in a women to 1 in male players. And this has been the case for many years, but there are few studies looking at male handball players and the number of ACL injuries there. So actually we don't know how the numbers are today, but we did, as you also see here, playing matches is the high-risk situation for having an ACL injury. It's a 30-time higher risk in matches compared to training. So if you stop playing matches, there will be few ACL injuries, but very boring. I will shortly just go through this ACL prevention study because this has changed the number of ACL injuries and the incidence in Norway. This was studied back in 98-99 when we counted the number of ACL injuries in female, the 3 female levels in Norway, about 1,000 players. And we had 2 intervention seasons where the players did a prevention program, consisted of 3 types of exercises with progression. We had floor exercises, balance exercises on an AirX balance mat, and a wobble board exercises. And we focused a lot on knee over toe position, the 2-leg landings, a more narrow cut, and had exercises focusing on balance, strength, and plyometrics. And we had a reduction of the number of ACL injuries from, as you see in the first control season, we had 29 ACL injuries and went down to 17 after the 2-year intervention. It was not significant, that reduction, but the interesting thing was when we looked at the elite players, the top-level athletes, the ones who didn't do this program had a 16 times higher risk of getting an ACL injury. So for those who did the program, it protected them. And that's important to keep in mind. As always, the exercises have to be done to have success. And what happened afterwards? We have followed these same divisions, the elite, first and second division, for a lot of years, as you can see here, from 98 and up till 2011. And in black, you see the control season where we only counted the numbers. Then we had the 2 intervention season when we got a reduction. And then you see how it increased when we withdraw from the clubs. The clubs had to do it themselves. And after that terrible numbers in 2004, 2005, we decided we had to do something. So we really increased the work with the clubs. We had a lot of seminars. We had a website opening for all the coaches and the players, free of access, so they could go and see how this program worked. And as you see, we have had a great reduction. So we have actually reduced the number of ACL injuries in female Norwegian handball with 50%. So now we have 0.25 ACL injuries per team per season compared to up to 1 when we started. So this, you can read in this number of British Journal of Sports Medicine, mission is possible to reduce the number of injuries. So let's go over to the overuse injuries. How does it look like? And the same study from Denmark showed that 15% of the injuries occurred in the shoulder. The leg stands for 24% of the injuries, knee 21, ankle 7, and low back 5. And just go into a couple of the specific diagnoses, and we know that jumper's knee is the problem also in handball. And a study from 2005 compared handball with volleyball and basketball, and you see that handball, male handball players was a prevalence of 14%, while the females only had 5%. So this is more a male problem than a female problem. And a study from 2011 showed that the prevalence was the same among handball players in the non-elite division, but the volleyball and basketball numbers were much lower than in the elite level. So now there's a lot of focus about shoulder overuse problems. When I have talked with coaches in handball, they have told me that our biggest problem is athletes having pain and problems in their shoulder, a more throwing shoulder. So we did a study among elite female players and examined 179 players and also had a questionnaire. And among those 179 players, 57% reported current or previous shoulder problem. So it's a really common problem among female players. And among the players who reported the current problem, it had a great impact of their training. They missed matches because of shoulder pain, 36% did that. And a lot of them needed medical help. 76% had physical therapy management. And 28% of those players experienced instability in their throwing shoulder. And as you see, 43% reported that the pain problem interfered with their handball skills. So what about the male players? What do we know about that? And really a recent study by Clarkson and his co-workers. Ben Clarkson defended his PhD Tuesday, so this is quite new numbers. And we wanted to see if the male players had the same problem as the female players. So we wanted to record the prevalence of the shoulder problems and also wanted to see if there were an association between the shoulder range of motion, the strength and scapular dyskinesis, and shoulder injury. And this was Ben Clarkson, you saw there. And this is a prospective coach study, which we did in the Norwegian top-level league. We did a pre-season screening, and the athletes answered a questionnaire every second week. We sent them a questionnaire every second week to get knowledge about if they had problem with the shoulder since the last time we asked them. And we used about 10 minutes per player on the examination, and 206 of 230 players were screened. We did testing the range of motion with a digital inclinometer. We tested internal rotation, external rotation, and the total rotational motion. We tested isometric strength in internal rotation, external rotation, and elevation in the scapular plane. And we also did scapular control testing. The athletes had 5 repetitions with 5 kilos in flexion and abduction. And we have a subjective rating of the scapula and rated it as normal, subtle dyskinesis, or obvious dyskinesis. And we could see, of course, a lot of shoulders or scapulas like this. The injury registration compared to 4 questions. We asked them, have you any difficulties participating in normal training and matches due to problems with your throwing shoulder? To what extent have you reduced your training volume due to problems with your throwing shoulder? and to what extent have problems with your throwing shoulder affected your performance. And last, if they had experienced shoulder pain related to playing handball. So these were the 4 questions they got every second week. And to get a knowledge about how big this problem was, we gave them a score between 0 and 25 for each of these questions. And we wanted to check that if it was really it's not only a sore shoulder. If you have maybe answered, you had full participation but a little bit shoulder problem and get an 8, okay, that could be that you have a sore shoulder. But we wanted to know if it really affected your shoulder in a hard way. And then we gave them, we counted out the scores. And this is a way you can see one player having 15 recordings during the season. And then you see that this player had a lot of problems with the shoulder, but maybe no time loss. This is the typical way. This is a problem shoulder, especially in the first week. It's getting better, but the player is still on the court. He's playing and he's training. He has no time loss, but he has a lot of problems with his shoulder. So the results from this study showed us that this is also a really big problem among male players. 52% of the male players had shoulder problems during the season, and the average prevalence was 28%. And 24% had substantial problems during the season. And what we mean by substantial, that they scored moderate to severe problems with the shoulder and totally out of the play. So this is really problems, not only a sore shoulder. And the average prevalence of substantial problems was 12%. And just shortly to show you a little bit about the risk factors we associated with the shoulder problems. The players with reduced glenohumeral total range of motion, they had a higher risk of getting shoulder problems. Players who had weakness in the external rotators had an increased risk of getting shoulder problems, and players with an obvious scapular dyskinesis had an increased risk of getting shoulder problems. So in a prevention study, of course, this is factors that we should address. And also we did, during that season, we went to the 12 clubs 1 week and counted all the throws and all the shots they did during a training week. And as you see here, they had 120 throws per hour of training and 31 high-intensity throws per hour. You have not the data from the match, which we have seen earlier today, but this is what the numbers from the training session during 1 week with the recording of the throwings. Okay, what do we know about the matches, match injuries versus training? For all injuries, we know that you have a 15 times higher risk of getting injured in matches compared to training. And as I mentioned earlier, regarding ACL injuries, you have 30 times higher risk in matches compared to training. Injury onset, what do we know about that? Okay, there's actually little knowledge about it, but the same ACL injured players I talked about earlier, we also recorded all the injuries that occurred in matches. And what we saw that that part of the study was that more of the ACL injuries actually occurred in the first half, not in the second half, which a lot of people talks about. The ACL injuries occurs, maybe one of the reasons could be that they are really tired at the end of a match, but this is not the case when you look at these data. And of course, this slide shows that most of the injuries occurred in training after they had done their warm-up. So what about the clinical outcome? The different studies shows that between 5 and 36% of the injuries are major. That means that they have time loss more than 4 weeks. And we know that studies looking at the knee osteoarthritis shows really high, from low to high numbers after ACL injuries. So it's actually a big problem with knee OA. So to summarize, the incidents have been shown with numbers between 2.6 up to 40 injuries per 1,000 hours. The back players have the highest risk on getting injured. We see more injuries in matches than training sessions. And the acute injuries occurs mostly in ankle, knee, hand and finger. And the overuse injuries are mainly dominated by shoulder, leg and knee. And I think it's so important that we get more knowledge about the overuse injuries, which we see a lot of in handball. We need to have risk factor studies so we have a possibility to find out how we can prevent the injuries. And of course, the coaches and the athletes had to be educated in how to have a safer handball, how we can prevent injuries, so we can make handball a more safe and injury-free sport. And I think we could all agree on that prevention is so important. So handball could be a safer sport, so we can see the player play for many years instead of getting injured. So with that, I say thank you for your attention.
And at 11 or 12, the must go to the player. So one question for here. Questions? One question,
thank you. We saw many injuries in handball. My question, do you think, or did you have any recommendation or advice to International Handball Federation to change some laws in handball?
The laws of handball?
To change or to advise to change some laws in handball.
Yeah. The rules for handball?
Yeah.
Yeah.
Law.
Well, I don't know if I could try to get some good ideas on that, on where I stand now, but I think what we need to address is the number of matches that they play during a championship, because there have been really many matches playing. Can you hear me? I think it's so important that the number of matches is maybe reduced in championships, because if you play too many matches, we know that the risk is getting higher. So that there are time to recover between the matches, I think it's important. But regarding rule changes, I have no special in mind. I think they have been better to get red card when you are getting attacked from behind, and I think that you have to use the rules you have as best as possible.
Thank you.
Oh, say the last question, please. Okay?
Hi. There is no mention about muscle injuries. What will be your experience in that regard?
That there are a lot of muscle injuries, would you say that?
Yes, a lot. Or what do you see when you have done in these epidemiological studies?
Yeah, there are a lot of contusions, we see that, and strains. So those are the two main problems regarding muscle injuries. So what can we do that? I have no good solution for what you can do. It is the part of the play maybe to have contusions, because it's a contact sport. But to be well prepared is probably a good idea to manage with the load for the muscles. If that was the question, I didn't know if I talked. You can take it more afterwards, maybe.